So we're filming a PSA on depression, and I think the first we can talk about is symptoms. Some symptoms relating to teenagers. I think one of the most common ones is school, can be a stressor or a cause with grades, and especially here at Mason, you get a lot of people who get super overwhelmed, which will, once you're overwhelmed and super anxious, it can cause a lot of issues where you feel very drowsy, you get super lazy and anxious and really upset with yourself. You don't really like yourself, and you lose a lot of relationships because you're so down all the time. And I think this is really common in teenagers, and if you don't notice these symptoms early, it can really affect you in the long run.
Yeah, the next thing we can talk about is treatments. The first thing is therapy, especially cognitive behavioral therapy. And there's also medications and a medical procedure called electroconvulsive therapy, also known as shock therapy.
And then also just talking to a counselor and talking through problems that you're having is also a really good way to just cope and figure out, a little bit more about what's going on. I think the next one that we should cover is what our schools and administration and teachers can do. I think personally that, especially what we're doing here with Hope Squad and other things like that, are really, really good. It lets people, if they don't have anybody to talk to, it gives them somebody to talk to. They do a lot of, PSAs like we're doing right now on the fact that, you aren't alone. Other people are going through the same thing, and I think that, teachers and administration should keep focusing on this because, suicide rates are only going up every single year by very, very large percentages. Every 100,000 people, it used to be, 8, 9 people back, in the late 1990s or, early 2000s, and now it's at a record high of 14 to 15 people per 100,000. That's a lot, and a lot of it is teenagers and people between the age of 15 all the way up to 25, 30, which is it's sad. And I think that teachers and everybody should just keep making people feel like they're wanted here, and always be there for somebody when they don't feel like they have anybody and they're alone. So that's all. See ya. Catch you later. Adios. Goodbye.